Multiple sclerosis, MS, is a potentially disabling disease of the brain and spinal cord, central nervous system. In MS, the immune system attacks the protective sheath, myelin, that covers nerve fibers and causes communication problems between your brain and the rest of your body. Eventually, the disease can cause permanent damage or deterioration of the nerve fibers. Signs and symptoms of MS vary widely between patients and depend on the location and severity of nerve fiber damage in the central nervous system. Some common symptoms include numbness or weakness in one or more limbs that typically occurs on one side of your body at a time, tingling, electric shock sensations that occur with certain neck movements, lack of coordination, unsteady gait or inability to walk, partial or complete loss of vision, prolonged double vision, blurry vision, vertigo, problems with sexual, bowel and bladder function, fatigue, slurred speech, cognitive problems, and mood disturbances. In a New York Times interview, Christina Applegate explained that she now realizes that numbness and tingling sensations as well as balance problems she had while filming a dance number likely were her first MS symptoms. A diagnosis of multiple sclerosis often relies on ruling out other conditions that might produce similar signs and symptoms. Tests that may be used to establish the diagnosis are MRI, which can reveal areas of MS lesions on your brain and spinal cord. A spinal tap, lumbar puncture, is a procedure in which a small sample of cerebrospinal fluid, CSF, is removed from your spinal canal for laboratory analysis. The CSF of people with MS usually contains a specific group of proteins called oligoclonal bands and an elevation of the level of protein. These findings indicate an abnormal immune response within the central nervous system. Evoked potential tests measure the electrical activity of the brain in response to stimulation of sight, sound, or touch. When the brain is stimulated by sight, sound, or touch, signals travel along the nerves to the brain. There, electrodes detect the signals and display them for your doctor to interpret. In multiple sclerosis, MS, as the immune system attacks the myelin, the substance that surrounds and protects the nerve cells, this can slow down the transmission of nerve signals. Evoked potential tests can indicate nerve pathways that are damaged, even before you notice any clinical symptoms. There are three main types of evoked potential tests. Visual evoked potentials, which measures the electrical signals your visual cortex generates in response to visual stimulation. Brainstem auditory evoked potentials, which measures the electrical signals the auditory pathway in your brain generates in response to sounds. Somatosensory evoked potentials, which measures your brain's response to mild electrical stimulation in various places on your body. Want to know more? Watch my channel.